Welcome to the Codecast Podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast Podcast today. My name is Terry Fletcher. So our topic today is going to be concierge and direct primary care model practices. So I've been mentioning this a couple of times over the last couple of weeks, but since we had some other breaking news to get to, I haven't been able to really bring this topic to you, and it has been in the news and just kind of all over healthcare magazines. So I want to talk about it, and first what they are and what are the differences between concierge medicine and what they call DPC, direct primary care. And then, is anyone making money at it? And what are the regulatory and legal issues that are part of each model? But it's just an interesting type of delivery of healthcare, if you will. And I think a lot of people are buying into it, and I use that pun intended when you hear what it is, because it's a different way for the physicians to figure out their revenue opportunities and to see if they want to continue in what we call traditional medicine versus getting paid directly from a patient. But first, the Codecast podcast is also brought to you by Concierge Medicine of USC, 500 plus nationally renowned physicians at a leading academic medical center, keeping you healthy, on track, and doing the things you love. The Keck Effect, keckmedicine.org, and Simple Health Radio. Join Dr. Emron each week on his radio podcast to discuss current health topics, simplehealthradio.com, Houston, Texas. Okay, so first of all, I did think that my listeners and some of my readers on my blog did know the difference between the two practices, but I've had a number of readers, a number of listeners say, Terry, can you just talk about the blurred lines and the regulatory issues, and is it something that my doctor really should do? They're really trying to decide if this is something they want to move into because they're tired of traditional insurance medicine. And so when we say that, it's basically insurance companies paying the bill. Now, your doctor may be tired of it, but the patients like to get paid for whatever is under their coverages, meaning that most patients are going to want their insurance company to cover their procedures and services, et cetera. But this is a different model. So let's take a look at what it is actually. So by definition, direct care doctors do not accept money from insurance. So they've pretty much opted out of Medicare, and they rely mainly on a monthly fee of less than $100 a month, give or take. And then as a consequence, they have larger panels, so between 400 and 800 per provider of patients per month. And they also focus on the patient who is healthier and also younger. And they focus more also on saving money than offering premium services. So that's a DPC doctor, or direct patient care, or direct primary care. On the other hand, concierge practices, so they often accept money from insurance, but consider that an asterisk on what I'm going to be talking about for concierge. They charge a higher monthly payment in addition to sometimes, again, insurance collection. But as a consequence of that, they have relatively small practices, or panels as they call them, between 200 and 300 patients total, sometimes less. I've had some physicians that only have 100. They also tend to focus on premium services, such as vascular scans. They call them executive lab panels, things basically the insurance company doesn't cover, extended office visits, even going along with patients with their specialists, having direct access. So a patient gets admitted to the hospital and they have their doctor's cell phone number on their phone, and they just call them and say, meet me there. A couple of other concierge practices, they have something called breakfast with the physician. They do it like Saturday morning or Thursday morning, and usually they limit it to who signs up of their concierge practice. And it's not offered to other patients. It's only offered to the concierge patients. And they can go have breakfast with them, talk about their health or anything like that they decide they want to talk about. Personally, I see a little bit of a HIPAA issue there. And then another physician I have in Arizona, he does something called a Sunday morning hike with patients, again, concierge patients. So there's a spectrum of services that are offered in both types of practice models, but the general idea of DPC is to avoid insurance and to lower their overhead and keep costs down, while concierge focuses on providing value-added services outside the boundaries of things usually covered by the insurance. But the danger zone here for concierge practices is that they must be certain that the extra fee does not duplicate the charge that they're collecting from an insurance company, especially Medicare, because that would be Medicare fraud. So if Medicare covers it, then they can't include that service within their concierge practice charge that they're charging to the patient. So a couple of things that have come up on this. Some doctors have said that, it's less patients, more time for each patient, which could be correct because obviously either practice, you're going to see less patients in the waiting room because they're paying for it themselves. So the doctors charge differently instead of trying to make it up in bulk with the insurance company. And in contrast, though, I've noticed that the DPC practices, they average between 6 to 10 patients a day with 30 minutes given to each patient. And then the concierge practice is usually anywhere from 2 to 5 patients a day. And sometimes they'll give up to an hour with each patient. So DPC doctors will tell you they offer affordable care, while concierge doctors will say, well, we offer premium care, kind of like coach versus first class seating on an airplane, if you will. So the definition of the word direct in direct primary care, doctors are paid directly by patients, not by third parties. So again, there's no insurance billing. So the Medicare contractually obligates providers to accept the negotiated rates. And so it would be a breach of contract, and in the case of Medicare, illegal, to accept payment directly from the patient in lieu of an insurance patient. That's why the physicians have to opt out. And then when you get into concierge, because sometimes they say, well, I do half and half, which to me is just so tricky because billing for non-covered services, you have to know exactly the list. It can vary by provider, insurance provider, and it regularly changes too. As we know, sometimes Medicare covers things, sometimes they don't. There's also some companies out there, third-party vendors such as MDVIP, that will help set up the practice and monitor this, but you're responsible. So regardless of what they do, you have to be careful. But in DPC practices, in contrast, they keep it very simple. So they basically charge a monthly fee that covers a registration fee if they choose to do one, and then the basic cost of labs, procedures, and medication. They like to say that they focus on less care and cost. So what they do is they feel that being paid by a set monthly fee means the doctors are rewarded for keeping patients healthy and decreasing their overall costs. So you're going to see less MRIs, less antibiotics prescribed, less time in the ER, because the doctors are trying to prevent problems because patients, even if they need it or not, are going to come in once a month. And so that's why they're paying their monthly fee. It's different for the concierge because they basically are paying this high fee and that's entitling them to premium services like in-office carotid Dopplers, bone density scans. But again, you hear some of these are covered by Medicare, but it's a premium experience, meaning they're more on call than expecting them to show up. And so definitely a big difference when it comes to both practices. But here's the 10 differences I want you to take away from this if it's something you're considering. So number 1, membership fee. So in concierge medicine, there's an annual fee that can be paid in full or split up, but the contract is for the entire year. In DPC, direct primary care, members typically pay a monthly fee and they can drop out of the program at any time. What a membership fee covers in concierge medicine, the annual fee covers an in-depth, comprehensive physical with screenings that go beyond what traditional insurance or government programs would support. And then in DPC, the membership fee generally covers unlimited patient visits. So you're kind of seeing the difference there. The cost, so concierge medicine membership fees, they tend to be higher. So basically what you see on TV, for example, you say, well, I have my own personal physician. And that's what they're talking about, that your doctor's available. Can be, sometimes it's a professional athlete has one, but it's usually affluent areas. DPC membership fees are usually priced on a sliding scale. So where younger patients pay less than older patients, and sometimes they even offer family rates. So third-party payers, so most traditional concierge medicine physicians, unfortunately, they continue to accept insurance plan and government programs, and patient visits are billed in their traditional manner if they're covered by Medicare or their insurance. In direct primary care, the doctor does not accept any insurance reimbursement. The membership fees paid by the patients cover basic visits, and some services are charged separately. So each model and contract, the patient needs to be aware of the ins and outs of it and that their out-of-pocket is a certain fee or membership fee. And here's where it gets a little bit trickier as well. So number 5, in-network referrals. A concierge medicine physician generally remains affiliated with insurance networks and therefore can refer to specialists who are also within the patient's network. But a DPC physician is an out-of-network provider, so referrals to specialists or for special lab testing may not be accepted by the insurance carrier. And then a question comes up about deductibles. And when Affordable Care Act came out and the Obamacare, this is when I saw a really big increase in both models, because with deductibles at $10,000 to $15,000, people are like, well, if I'm going to pay $10,000 anyway out of pocket, I might as well just pay it to a concierge physician who's on call for me and forget about the fact that I have insurance. But the annual fee a patient pays to a concierge medicine physician generally cannot be deducted, but any copay-related health costs can be deducted, as the concierge physician may still be in network. But because the DPC doctor is out of network, the annual fees a patient pays for membership or lab fees, it can't be applied to their deductible. Remember, none of this can be submitted to insurance. So both concierge medicine and DPC tend to offer easily available appointments with more physician connection, or they call it connectivity. As an in-network provider, a concierge medicine physician can serve as a patient advocate with outside specialists, hospitals, and other healthcare providers. But the DPC, since they're out of network and because they're not accepting insurance, they don't really have referral relationships. So sometimes it can make it difficult for them to advocate for the physician outside of specialists. And then the patient profile. So the average concierge medicine member is an empty nester over 50 years of age, living in an affluent area. And since DPC doctors don't accept Medicare, their members tend to be a little bit younger. Physicians who research properly before getting started generally increase their revenue when they start a concierge medicine program. DPC is still an emerging practice model, so there aren't really solid numbers that I was able to reference for that. But according to DPC Journal, 80% of DPC physicians moonlight outside of their practice to support themselves, but are moonlighting on things other than medicine. They said it's keeping their mind healthy where they're not burning out as quick. Now, concierge medicine, it's really a niche market, and it has been steadily growing for, I would say, 10 to 15 years. And the programs are most common in affluent areas. There's a big area I'm in Southern California, as most of you know. So in Brentwood and Beverly Hills area, and just up in that, ritzy Hollywood area, very much so in Malibu. But the affluent areas, they have flexible models, and they're very popular because everybody just wants their own doctor. They call and they get their doctor. Something funny. How many of you watch a soap opera? Yes, I'm guilty. I like The Bold and the Beautiful. But basically, when they call for their doctor, they get their own doctor on the phone. That's not normal. We know that in healthcare. You never get your doctor on the phone, but in concierge medicine, you can. DPC practices are most common and most successful in rural communities where there are physician shortages, and number of concierge medicine practices far outnumber the relatively small number of DPC practices. And so this is where you just have to be so cautioned about it. I was talking to a colleague the other day within one of the associations that I'm part of for healthcare consultants. And, David was talking to me about this, and he said, just be careful with Medicare patients when you're giving advice or information on this. He said, it is not that simple with Medicare. If any of the services are covered by Medicare, the provider cannot collect cash from the patient legally for services. If a concierge provider is intending to see Medicare patients and provide services that Medicare normally pays for, the provider has to opt out of Medicare, then document an individual contract. So complete contract language actually is provided by Medicare on what it has to say. And that has to be signed by the patient, and then the provider can charge whatever they want to the patient. There's no limit. So it's not the only way that it can be done, but it is the legal way it can be done. So there are some definite legal issues when it comes to understanding the concierge versus direct primary care. But hopefully I've given you some insight on that, because that was a topic I've been wanting to talk about for a while. So let's take a minute for our coding question today, which comes to us from a Utah Coding Corner client. And they ask, Terry, can you explain to me the global surgical package as defined by CPT? I'm a little bit confused. Okay, and I know a lot of people are confused because you're trying to figure out what's bundled, what can we bill for. But most coders and billers and clinicians, even though you're familiar with the concept of what a global surgical package or global period is, you may be unclear about when the period begins and ends and which procedures and services can be reported and paid for separately during that time. So let's talk about that. So let's first define the global surgical package. So the easiest way I can explain this is first imagine you are vacationing in an all-inclusive resort. Your room, food, entertainment, and transportation within the resort are included for a single price. This one price concept also applies to the surgical package. So, and this is defined not only by CPT, but also CMS, so Medicare. The global surgical package, also called global surgery, includes all of the necessary services normally furnished by a surgeon before, during, and after the procedure. Medicare payment for a surgical procedure includes the preoperative, intraoperative, and postoperative services routinely performed by the surgeon or by members of the same group within the same specialty. So exactly what procedures and services are included in this package? Well, sometimes it really depends on the payer. So if we go back to CPT, it says the following services related to the surgery when furnished by the physician or other qualified healthcare professional who performs the surgery are included in addition to the operation per se. Okay, so evaluation and management services subsequent to the decision for surgery on the day before and or day after surgery, including the history and physical. Local infiltration, metacarpal, metatarsal, digital block, or local or topical anesthesia. Immediate post-operative care, including dictating op report, talking with the family, other physicians, or other qualified healthcare professionals, writing orders, evaluating the patient in the post-anesthesia recovery area, and then typical post-operative follow-up care. And you need to know how many days, and Medicare has that listed on their fee schedule, either 0, 10, or 90. The list of procedures and services included in the global package is similar to what is in the Medicare booklet. And they have a global surgery booklet. You can Google it. So Medicare includes the following services in the global surgery payment when provided in addition to the surgery. So preoperative visits after the decision to operate. For major procedure, this includes preoperative visits the day before and after surgery. For minor procedure, this includes preoperative visits the day of surgery. Now, be careful with pre-ops because sometimes people will say, well, it says the day before, so we'll just do them 3 days before. If it's for the patient just to get their orders, just to get their, their scripts for after their care, and it's really not because, let's say they caught a cold and you're concerned about maybe the anesthesia they're going to go under because of breathing issues or fluid on their lungs or some kind of a respiratory infection, then these are still not things you should bill for, I would say, within a week prior to. Interoperative services that are normally and usual necessary part of the surgical procedure. All additional medical and surgical services required of the surgeon during the post-op period of the surgery. So because of complications, which do not require additional trips to the operating room, they're going to include that. Sometimes the patient may get fluid on their knee, or they may have dehiscence or wound care that needs to be done. That's all going to be included as part of that package. And then follow-up visits and go back and check on that post-op period related to the recovery. Major surgery is 90 days. That's included and part of your value, so your RVU that you're getting for the major surgery. At some point, they're going to take that off, but we haven't given an update on when that is. Post-surgical pain management by the surgeon is included. Certain supplies, except anything identified by the inclusion list. And then miscellaneous services, and this should be pretty straightforward. Dressing changes, local incisional care, removal of operative packs, any kind of removal of staples, sutures, lines, wires, tubes, drains, casts, splints, anything like that is part of that package to get the patient better and, they don't have to come back in for a month or so. So that's what they're talking about with that. Today's coding question was brought to you by Allegheny Health Network, Western PA's healthcare quality leader, ahn.org. So just an FYI, in addition to my second quarter webinar and seminar schedule up on our website, if you're in the market for any specialty coding workbooks, for CPT and ICD-10-CM, please look at my products page at terryfletcher.net. You'll find some coding workbooks for cardiology, orthopedic coding, gastroenterology, OB-GYN, and I have other specialties as well. And you'll receive it in digital format as soon as you pay for it. So something that you can consider if you're, just want really something that is easy to understand, but in an intermediate form. Also on my contact page, you can join our newsletter, which comes out quarterly with happenings in healthcare and some fun additions to avoid burnout. Which brings me to my personal tidbit this week. So I'm recording actually from Napa as we speak. I know I've mentioned it a couple of weeks in a row. I'm overlooking some beautiful land and vineyard landscapes, some gorgeous tasting rooms that we've gone to so far with water views, and just really an outdoor, setting. It's just great. And so I just wanted you to take the time to walk outside this week. It's spring. It's getting warmer, even though a little bit of rain here we ran into this week. But enjoy the fresh air. Even if it's for 5 minutes, it's worth it to go clear your mind, wake you up a bit, get you some vitamin D on your face, and get you out of the fog of staring at your computer or your electronic device. So I just strongly urge you to get out and enjoy a little bit of the outdoors if you can. So everyone, until next time, make it a great day, and thanks for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.